161. What is the best action for a nurse when a patient's tubing is disconnected? Answer. Clamp the tubing and reconnect using sterile technique. Rationale. Clamping prevents air entry and sterile reconnection prevents infection, per INS infusion standards. 162. What should the nurse do when a patient with a new diagnosis feels overwhelmed? Answer. Provide simple, clear information and offer emotional support. Rationale. Clear information and support reduce anxiety, promoting coping per ANA communication standards. 163. What is the priority action for a nurse when a patient's oxygen saturation drops suddenly to 80%? Answer. Administer high-flow oxygen and notify the provider immediately. Rationale. Severe hypoxemia requires immediate oxygen escalation and evaluation, per AACN standards. 164. What should the nurse do to prevent pressure injuries in a patient with a cast? Answer. Assess skin under the cast edges and pad bony prominences. Rationale. Skin assessment and padding prevent pressure damage, per NPIAP guidelines. 165. What is the best action for a nurse when a patient's NG tube is not in place for a scheduled feeding? Answer. Verify placement with pH testing or X-ray before feeding. Rationale. Confirming placement prevents aspiration, ensuring safety, per ANA clinical standards. 166. What should the nurse do when a patient with a visual impairment needs to navigate the room? Answer. Orient the patient to the room layout and keep pathways clear. Rationale. Orientation and clear pathways promote safe mobility, per ANA sensory impaired care standards. 167. What is the priority action for a nurse when a patient's incision shows evisceration? Answer. Cover the wound with sterile saline-soaked gauze and notify the provider immediately. Rationale. Evisceration is a surgical emergency requiring sterile coverage and urgent intervention, per ACS guidelines. 168. What should the nurse do to promote hydration in a patient with dysphagia? Answer. Offer thickened liquids and monitor swallowing. Rationale. Thickened liquids reduce aspiration risk, and monitoring ensures safety, per American Speech-Language Hearing Association, ASHA, guidelines. 169. What is the best action for a nurse when a patient's pulse oximeter is not detecting a signal? Answer. Check the sensor placement and clean the site if needed. Rationale. Proper placement and a clean site ensure accurate readings, per AACN monitoring standards. 170. What should the nurse do when a patient with a terminal illness requests no visitors? Answer. Respect the patient's wishes and communicate the preference to staff. Rationale. Respecting autonomy promotes dignity and comfort, per ANA Code of Ethics. 171. What is the priority action for a nurse when a patient's blood glucose is 600 milligrams per deciliter? Answer. Notify the provider and prepare for 4 fluids and insulin. Rationale. Severe hyperglycemia risks diabetic ketoacidosis, requiring urgent treatment, per ADA guidelines. 172. What should the nurse do to prevent infection during a sterile procedure? Answer. Maintain a sterile field and avoid reaching over it. Rationale. A sterile field prevents pathogen introduction, ensuring safety, per CDC infection control guidelines. 173. What is the best action for a nurse when a patient's urinary catheter is leaking? Answer. Check for blockages and ensure proper catheter size. Rationale. Blockages or improper sizing cause leaks, requiring correction to prevent skin breakdown, per CDC catheter care guidelines. 174. What should the nurse do when a patient with anxiety needs preoperative teaching? Answer. Use simple language and allow time for questions. Rationale. Simple explanations and interaction reduce anxiety, promoting understanding, per ANA communication standards. 175. What is the priority action for a nurse when a patient's surgical drain is blocked? Answer. Notify the provider and attempt to clear the blockage if ordered. Rationale. Blockage impairs drainage, risking infection, requiring prompt intervention, per ACS guidelines. 176. What should the nurse do to promote comfort in a patient with a fever? Answer. Offer lightweight clothing and maintain a cool room temperature. Rationale. Lightweight clothing and a cool environment prevent overheating, per CDC fever management guidelines. 177. What is the best action for a nurse when a patient's foresight is red and warm? Answer: discontinue the fore and notify the provider. Rationale: redness and warmth indicate phlebitis, requiring removal to prevent infection, per INS standards. 178. What should the nurse do when a patient with a colostomy has a high-output stoma? Answer: monitor fluid and electrolyte balance and consult a dietitian. Rationale: high-output risks dehydration, requiring monitoring and dietary adjustments, per WOCN guidelines. 179. What is the priority action for a nurse when a patient's respiratory rate is 40 breaths per minute? Answer: administer oxygen and assess for underlying causes. Rationale: severe tachypnea indicates respiratory distress, requiring oxygen and evaluation, per AACN standards. 180. What should the nurse do to prevent falls in a patient with a history of seizures? Answer: keep the bed in the lowest position and use padded side rails. Rationale: a low bed and padding reduce injury risk during seizures, per Epilepsy Foundation guidelines. 181. What is the best action for a nurse when a patient's wound is not healing? Answer: assess for infection and consult a wound care specialist. Rationale: non-healing wounds may indicate infection or poor perfusion, requiring expert evaluation, per CDC wound care guidelines. 182. What should the nurse do when a patient with a PEG tube needs medication administration? Answer: crush medications if allowed and flush the tube before and after. Rationale: crushing and flushing ensure delivery and prevent clogging, per Aspen enteral nutrition guidelines. 183. What is the priority action for a nurse when a patient's heart rate is 180 beats per minute? Answer: notify the provider and prepare for cardiac monitoring. Rationale: severe tachycardia risks arrhythmia, requiring immediate evaluation, per AHA standards. 184. What should the nurse do to promote bowel regularity in a patient on opioids? Answer: administer prescribed laxatives and encourage fluids. Rationale: opioids cause constipation, requiring laxatives and hydration to prevent impaction, per ANA fundamental care standards. 185. What is the best action for a nurse when a patient's oxygen mask is slipping off? Answer: adjust the straps and ensure a snug fit. Rationale: a secure mask ensures consistent oxygen delivery, per AACN oxygenation standards. 186. What should the nurse do when a patient with a new diagnosis requests more information? Answer: provide written materials and explain in simple terms. Rationale: written and simple explanations enhance understanding, per ANA patient education standards. 187. What is the priority action for a nurse when a patient's incision is swollen and hot? Answer: notify the provider and apply a sterile dressing. Rationale: swelling and heat suggest infection, requiring urgent evaluation and sterile coverage, per CDC wound care guidelines. 188. What should the nurse do to promote safety in a patient with a cane? Answer: ensure the cane has a rubber tip and teach proper use. Rationale: a rubber tip prevents slipping and proper use ensures stability, per Joint Commission Fall Prevention Guidelines. 189. What is the best action for a nurse when a patient's NG tube is displaced? Answer: stop any feedings and notify the provider. Rationale: displacement risks aspiration, requiring immediate cessation and evaluation, per ANA clinical standards. 190. What should the nurse do when a patient with a tracheostomy needs oral care? Answer: use a soft toothbrush and avoid aspiration risks. Rationale: gentle brushing prevents infection, and aspiration precautions ensure safety, per AACN tracheostomy care standards. 191. What is the priority action for a nurse when a patient's blood pressure is 80/50 mmHg? Answer: place the patient flat and notify the provider. Rationale: severe hypotension risk shock, requiring positioning to improve perfusion and urgent intervention, per AHA standards. 192. What should the nurse do to promote comfort in a patient with joint pain? Answer: Apply a warm compress and position for comfort. Rationale: warmth and proper positioning reduce pain and stiffness, per ANA Fundamental Care Standards. 193. What is the best action for a nurse when a patient's pump is beeping continuously? Answer: check for occlusion or air and troubleshoot the issue. Rationale: troubleshooting restores infusion, preventing delays, per INS infusion standards. 194. What should the nurse do when a patient with a cultural dietary restriction needs a meal plan? Answer: collaborate with the dietitian to meet cultural needs. Rationale: cultural respect enhances adherence and satisfaction, per ANA Culturally Sensitive Care Standards. 195. What is the priority action for a nurse when a patient's tracheostomy is blocked? Answer: suction the tracheostomy and attempt to clear the obstruction. Rationale: blockage is a life-threatening emergency requiring immediate suctioning, per AACN Tracheostomy Care Standards. 196. What should the nurse do to prevent dehydration in a patient with vomiting? Answer: offer small sips of oral rehydration solution and monitor electrolytes. Rationale: small sips and electrolyte monitoring prevent dehydration, per ANA Fundamental Care Standards. 197. What is the best action for a nurse when a patient's wound dressing is wet? Answer: change the dressing using a septic technique. Rationale: a wet dressing increases infection risk, requiring sterile replacement, per CDC Wound Care Guidelines. 198. What should the nurse do when a patient with a mobility aid reports arm pain? Answer: assess for overuse injury and adjust the aid's fit. Rationale: proper fit reduces strain, and assessment identifies issues, per OSHA Ergonomic Guidelines. 199. What is the priority action for a nurse when a patient's oxygen saturation is 87% on 4 liters per minute? Answer: increase oxygen flow and notify the provider. Rationale: severe hypoxemia requires immediate oxygen escalation and evaluation, per AACN standards. 200. What should the nurse do when a patient expresses guilt about their condition? Answer: listen actively and refer to counseling services if needed. Rationale: empathetic listening and referral support emotional well-being, per ANA Holistic Care Standards.